Hello everyone, welcome to Dr. Kim's Dental Radiology channel. Today I have series of maxillary periapical radiographs. Why don't we start out with identifying a tooth number, and one way I like to do is recognizing the maxillary canine. So this being tooth number 6, that helps us to know that's 7 and 8, and this is 5 and 4 and 3. Likewise, 6, 7, 8, 9, 7, 8, 9, and 10. Where I want to draw your attention to is tooth number 7. This is restored with PFM crown, and above the crown you can see that there is a radiolucency extending to almost the midroot, perhaps just shy of the midroot. But what's unique about this radiolucency is that along its border it has thin radiopaque line. Let's take a look at this in other view. Again, thin radiopaque line along its border. Let's look here as well. Thin radiopaque line. Okay, so based on that, what is your differential diagnosis? There are a couple things I think we can consider, and I like one over the other. I think we have to strongly consider dens in dente. Dens in dente because of that radiopaque line. What I don't have is whether there was a history of restoration, or whether some type of radiopaque liner or composite material was placed into this area. That's what I don't know, but presuming that no restoration has been done to address this area, dens in dente would be my number one differential diagnosis. The second one that I would consider, although not as strongly, is the internal resorption. Just because there's a radiolucency relatively in the center of a root, you could consider internal resorption, but there are things that I do not favor that as much. Again, because of the presence of the radiopaque marker, and with internal resorption, you want this radiolucency to be continuous with the pulpal canal. It is hard to visualize the pulpal canal. It's really hard, but I don't see clear evidence that this radiolucency is an expansion of the canal and the continuation with the rest of the root canal, which is lacking. So because of that, I would certainly favor dens in dente much more so than internal resorption, and pretty much I'm gonna say this is a dens in dente. Here I believe is the pulpal canal, and it's slightly off-centered from here to the location or angulation of this. So I don't think that this is a continuation with the canal. Therefore, I'm going to say dens in dente as my final definitive diagnosis. However, if you considered internal resorption, I think that's still a decent differential diagnosis for you to consider. Alright, thank you everyone. I hope that was interesting, and see you in the next video. Take care.